Welcome. We invite you to join us for a typical day in the Clinical Immunology and Allergology Laboratory, as an integrated part of the Allergology Clinic Department of NICOLAE MALAXA Clinical Hospital, starting from the pre-analytical phase and extending through to the post-analytical phase. In vitro and in vivo tests are complementary pillars of allergy diagnostics, providing a comprehensive approach to identifying such allergen triggers and guiding personalized treatment. This overview draws on standard laboratory practices for allergy diagnostics, emphasizing efficiency, accuracy, and patient safety. In vitro tests play an essential role in establishing an allergy diagnosis, as an alternative or complementary approach to in vivo tests. The workflow follows a structured sequence to ensure reliable results, minimize errors, and comply with quality standards. The first step begins typically early in the morning, with pre-analytical phase or planning and preparation, with a good interdisciplinary team dialogue where laboratory staff and clinicians work together to determine which tests are appropriate and available for each patient and the order in which those tests should be conducted. Laboratory staff review schedules, confirm test orders from clinicians, and prepare resources. For instance, they might check the inventory of reagents for in vitro tests. Quality control protocols are reviewed, such as verifying sample transport conditions to prevent degradation. This stage sets the foundation for smooth operations, often involving team briefings to prioritize cases for allergy screenings. Once planning is complete, the focus shifts to obtaining and preparing samples in the second so-called pre-analytical phase, that is, sample collection and handling. Patients arrive for procedures, such as drawing blood for in vitro tests or preparing for in vivo procedures. Staff ensure proper consent, verify patient identities, and handle samples under sterile conditions to avoid contamination. Blood samples are labeled, centrifuged, and stored at the correct temperature before analysis, this phase being critical to accuracy, as any mishandling could lead to false results and impact patient care. Meanwhile, in vivo clinical tests, such as skin prick tests for respiratory, food, and drug allergies, patch tests for contact dermatitis, and intradermal tests with drugs or autologous serum for autoreactivity in chronic urticaria, are performed on patients under supervised conditions. Such in vivo tests performed directly on the patient provide immediate insights into how the body reacts to allergens. In vitro tests involve analyzing biological samples, such as blood, to provide objective, quantifiable results. For example, a test for serum-specific IgE antibodies can detect sensitivities to allergen natural extracts or recombinant molecules, with high precision. Such tests pose no allergy risk to patients. The third step is the highlight of the day, the analytical phase, i.e., testing and analysis, during which actual lab diagnostic tests are performed. In vitro tests, such as multiplex IgE immunoassays, based on nanotechnology, are used to detect molecular sensitization profiles. Different immunoassays are run on automated analyzers to detect other antibodies and serum-specific proteins. After this stage, results are interpreted and reported during the post-analytical phase. Quantitative data from in vitro tests, such as serum IgE levels, are compared against established reference ranges. Detailed reports are created using secure software platforms. This phase includes quality checks, such as cross-verifying results for consistency, before sharing them with clinicians through electronic health records. Patient history and in vivo testing results are also documented in the medical records to assess clinical relevance. The day wraps up with other important activities, such as archiving data, conducting audits, and reviewing the day's performance. Moreover, staff members analyze trends, such as specific allergens in the local population, and explore ways to improve future protocols. If discrepancies arise in the results, corrective actions are implemented as necessary. Additional tasks include equipment calibration and the safe disposal of biohazardous waste. Throughout the day, close collaboration among allergists, immunologists, and lab specialists ensures a smooth, efficient workflow. An integrated approach, combining real-time teamwork with ongoing professional development that supports high-quality care. Allergy tests are not performed merely for the sake of testing itself or to satisfy curiosity in identifying triggers or in deciphering the underlying immunological mechanisms. They are of essential importance for the patient, enabling effective preventive measures and truly personalized treatment strategies that significantly improve quality of life and positively influence the future evolution.
Lab tests confirm exactly which pairs I'm allergic to, which really helped me improve my quality of life, and surprisingly it even turned my career in a better direction.
Laboratory diagnosis is essential in the evaluation of allergic patients. It provides detailed mapping of sensitization profiles by identifying specific triggers and immune patterns. This information enables accurate diagnosis and supports the design of individualized evidence-based treatment strategies.
To conclude our day in the lab, remember that true success comes not only from collaboration between machines and data, but also from collaboration among real people.
Thank you very much.